Hello everyone, I'm back with a new video. This is Noor. Today we will talk about hypertension treatment. I understand that there are a lot of medications out there that gets us super confused, but don't worry, by the end of this lecture you'll be able to get a general grasp of what these medications are useful for and how to answer questions with the limited information that is given in our question stem. Okay, so the first thing that I want all of you guys to do is write down your ABCs. Okay, so A stands for ACI. A stands for ACI or ARBS. So this angiotensin converting enzyme inhibitors are very good medication. They are both renoprotective and cardioprotective. All right, let's move forward and talk about B. B is your beta blockers. C is your calcium channel blockers, and D stands for diuretics. So this is a general overview of different categories of hypertensive medications that we have and that we get questions asked on. Okay, now moving forward, what I will do is I will break it down for you in a way that is easy for you to understand. Okay, the first thing that I want you guys to see in a question stem is what is the age of your patient. And the cut point that we're taking here is 55 years. So if your patient's age is less than 55 years, your preferred choice of medication will be ACI. Okay, A. And if it's more than 55, or if the patient is an African or Caribbean, you will choose C, calcium channel blocker. This is your step 1. All right, now let's move forward. What if we see that we've given them the medications but the blood pressure is not coming under control? You move to step 2. That is, you give them the combination of these drugs. Okay, now what if the blood pressure is still not under control? You go to step 3, which is ACI plus calcium channel blockers plus your diuretics, right? And what if it's still not getting controlled? You will give them the same medication. First you will try to increase the dose of diuretics, and if still no help whatsoever, then you can consider giving beta blockers. Okay, so this general overview is basically used for primary hypertension, right? So this general overview is for primary hypertension. All right, so the medications preferred are ACI, calcium channel blockers, diuretics, and if nothing works, then the last option should be beta blockers, right? Okay, so now what I'm going to do is I'm going to take hypertension in different scenarios and talk about the medication that we should and should not give, because for USMLE especially, it's very important to not only know what medications to give, but it's also very important to know which medications to avoid. Okay, so let's first take hypertension with diabetes mellitus. Now this is a very common occurring in a clinical setting. Almost every other patient who would have hypertension would also have diabetes mellitus. So this you should have a very clear understanding of. Okay, so in diabetes, the most common complication that we see is normally diabetic nephropathy. Yeah, so therefore the treatment that we want to give our hypertensive patient who are also diabetic is ACI. And why is that so? Because ACI is renoprotective. It prevents the development of nephropathy. So it's a very good medication, right? And now important thing here to remember. In patients with diabetes mellitus, beta blockers, if you want to give beta blockers, be very, very, very cautious. And why is that so? So what happens is, when your blood sugar level starts dropping, your body shows different signs for you to understand that fine, the blood sugar levels are dropping. What are those? The most important one is your heart rate will start rising. There will be palpitations, sweating, etc. Now what happens is, if you give them beta blockers, it will prevent the heart rate from increasing. So it will mask the symptoms of hypoglycemia. Therefore, you should be very cautious when you want to give beta blockers to a diabetic patient. Why? Mass hypoglycemic symptoms. Okay, now that that is clear, let's move forward and talk about hypertension with heart failure. Okay, so when your heart is failing, your heart is not working properly, what happens? What are the symptoms that you normally see in a patient? That will help you figure out the medications. Okay, so in a heart failure patient, there is excessive buildup of fluid in the body, right? So what does that cause? That causes edema, excessive fluid buildup in the body. Now, what is that hypertensive medication that we use to get rid of fluid from the body? That is diuretic. So if you have the symptoms in your mind, it would be very easy for you to figure out the medication. So the first medication that we can give in heart failure is diuretics, right? Now, we said that our heart is failing, right? And we said that ACI and ACIs are both cardioprotective and renoprotective. So in diabetes, our kidneys are at risk, so we give ACI because it is renoprotective. In heart failure, our heart is at risk, so we give ACIs because they are cardioprotective, right? So another medication that should be talked about here is aldosterone antagonist. And why is that so? Because aldosterone, the hormone aldosterone, is responsible for uptake of salt and water. And in heart failure, there's already buildup of salt and water in the body, so we don't want further reabsorption of salt and water. So if we give an antagonist, then aldosterone would stop the uptake, and that is basically what we require in a heart failure patient. Okay, so what about hypertension in an asthmatic patient? Okay, so the most important thing here for you to understand is that whenever we have an asthmatic patient, always remember that beta blockers, if we use, I would suggest that stay away from beta blockers. But if you want to still give beta blockers, only give cardio selective beta blockers. Why is that so? Because we have beta 2 receptors in our airways, and if we don't give cardio selective beta blockers, and if those beta blockers act on beta 2 receptors, there will be vasospasm and that would cause an asthma attack. You would be surprised to know how many times this question gets asked, and in how many different angles this question gets asked in. Okay, so for example, let me give you a scenario. A patient who has a history of asthma, had and also hypertensive, recently went to the clinic, got the medications changed, and now presenting with asthma attack. Okay, think about which medication could he be using. This is the first medication that should come into your mind: beta blockers, right? So maybe in the last clinic visit, or maybe he changed his doctor and did not give proper history, or the doctor did not take proper history and accidentally prescribed non-cardioselective beta blockers, which aggravated the asthma. All right, let's move forward and talk about hypertension in pregnancy. Okay, so I have a very funny saying that I always keep in mind for whenever I'm answering hypertension question in a pregnant patient. It is, La Bella is dope. Okay, so first line medication and the safest medication in hypertension is labetalol. So La Bella, first and safest medication, right, is dope. Okay, so what does dope stand for here? Dope stands for methyl dopa. So these two are the first line medications in a pregnant hypertensive patient. Okay, you can also give nifedipine and which is calcium channel blocker, and hydralazine, but these are the first line and the safest medication: labetalol and methyl dopa. Labella is dope. Okay, so that is all that I have for you guys today. I hope I made things clear for you. I hope that you will not have problems solving these questions in the future. So if you think that this video helped in any way, shape or form, please feel free to comment in the comment section below and subscribe to my channel, as it motivates me to make more videos to help you guys out in a difficult time, which I was once in as well. So take care and have a good day. Bye.